Today I discuss about shock. What is shock, pathophysiology of shock, and each types of shock and their treatment. So let's start. Shock is like ischemia. So it is a one type of ischemia. So before going to discuss about shock, we want to know what is ischemia. Ischemia is a lack of blood flow to the specific area of the tissue. For example, people with heart attack, coronary artery in the hearts get blocked. This is the coronary artery and it supply the blood into the left ventricle. So when it is blocked, what happened? The localized area of the heart tissue not get enough blood. That's mean if blood is not reach into this area, oxygen also can't get into this area. So tissue are also damaged into this area. So ischemia occur in this area due to low blood flow into the tissue. Now moves on the main topic, that is shock. Shock is a like of ischemia, but it not actually the ischemia. So what's happened in the shock? It's use a global scale, in other words, that's lead to failure of circulatory systems in whole body. So what actually happened in the shock? When blood flow of the tissue is dangerously low, that's mean oxygen can't get into the tissue. That's lead to cellular injury. So when cellular injury is occur, it's lead to damage of the multiple organ. That's mean leading to multiple organs failure. So if the ischemia is not treated immediately, it can also lead to shock. So what we see in shock, body's tissue are not getting enough oxygen via the blood. Normally what happened? Blood perfuse to the tissue and deliver oxygen because there is enough pressure into the circulatory systems. So the blood pressure is a major determinant for the amount of blood perfusing to the tissue. And these blood pressure are determined by two components. One is resistance of the blood flow to the vessels and another is cardiac output. Resistance of blood flow into the vessels depends upon the vessel's length, blood viscosity and vessel's diameter. Another determinant is cardiac output. It is the volume of blood pumped by the heart to the body per minute. It also depends upon the heart rate and stroke volumes. Heart rates means the number of beats per minute times, and another thing is stroke volume. That means amount of pumps blood out is beats. We can also say stroke volume is end diastolic volume EDV minus end systolic volume ESV. End diastolic volume depending on the filling and end systolic volume depending on how much it push out. So what is the definitions of shock? It is a pathological process characterized by intense failure of circulatory systems which maintain an appropriate blood supply to the microcirculations that result in life-threatening inadequate perfusions to the vital organ. So when the circulatory systems are failure, it's not maintain the appropriate blood supply to the microcirculations, and it's lead to inadequate perfusions of the vital organ. Now moves on pathophysiology. So let's discuss about in general pathophysiology of shock. When the blood perfusions are inadequate into the tissue, that means bloods are not get properly into the tissue. That means tissue are not getting oxygens properly, and this lead to ischemia or hypoxia. When the hypoxia or ischemia occur, that means oxygen levels are decreased. So if you not getting enough oxygen to the tissue, So you are not producing enough ATP by cellular respirations. This can decrease a lots of activity of the cell, and it's also linked almost completely cellular dysfunctions like protein synthesis, transport pump, molecular concentrations and neuron transmission. So when you not getting oxygen to the tissue, your body shifts from aerobic cellular respirations making ATP to anaerobic cellular respirations to making lots of lactic acids. So there is lactic acid accumulations occur. It's very bad because it's produce lots of proton, and protons are very acidic. So it's lead to decrease pH. So when lots of proton decrease the pH, it leads to metabolic acidosis. Metabolic acidosis has a negative effect on the hearts. It also causes vasoconstriction. That means blood vessels are constrict. So when the blood vessels are constrict, it can lead to failure of precapillary sphincter. That means sphincter is damaged or can't contact. Blood can flow into the capillary beds at high pressure. It also lead to peripheral pooling of blood. It's a condition that occur when venous wall and vulva in the legs are not working effectively. So, it's making difficulty for blood flow return to heart from the leg. Metabolic acidosis can also lead to cell membrane dysfunctions or failure to Na plus pump. It's lead to intercellular lysosome release the digestive enzyme. These are the normal cells and these are the affected of shock. Due to the metabolic acidosis, lysosomal membranes are ruptured and digestive enzymes are released. It also lead to efflux of the potassiums and influx of sodiums and H2O. There is also mitochondrial damages occur and cellular edema. Due to these all types of cellular dysfunctions, toxic substance enter into the cell and which leads to capillary endothelial damage. Ultimately, it leads to destruction, dysfunction and cell death. So, it is the general pathophysiology of the shock. I think all guys here understood easily.